Welcome to Black Women's Health. I'm Dr. Rahman, and this is a continuation of our conversation with our very special guest, Tamunoibim Sambo. We're discussing artificial intelligence. If you didn't hear last week's conversation, check it out. This week, I'm going to give my simple understanding of what has been in the past and how it is today. See if you agree with me, and then we're going to spend the rest of our time listening to our guest. This is such a huge topic. The more I read, the broader the subject becomes. So, what I like to do is give you my pedestrian understanding of what all of this is and why it's become such a big deal today. Okay? And I'm going to ask you to fill in where needed, correct as needed, and we'll just go from there. Okay?
Okay.
So, using computers, using machines to help us in daily life has been the order for decades. Computers and algorithms have been around since the mid 19 since 1950, if not before then. Um, Initially, computer processing was very slow, and there was a limit to what people could actually do with a computer. But over time and with study and evaluation and testing, the computers got faster, algorithms, coding was developed so that by um, 1990, computers were very fast, and we were using computers on a regular basis. In fact, in some instances, computers seem smarter than people. And the example that people bring up is um, the computer program was able to beat the best chess player in the world. So it was showing that um, computers had the capacity, had the speed to do things at a much more rapid pace than human beings. So far, so good?
Yeah, yeah.
All right. So then something interesting seems to have happened, I guess, starting in 2000, maybe a little bit after, in that not only were computers fast, and could do lots of rapid processing, but computers were able to, um, people were able to create programs so that computers could recognize speech. Computers could recognize images. And so we started getting things like Siri and Alexa, where we could say, tell me where such and such is, and we would get a response. Um, and that started to be incorporated into our daily life. I mean, but what was critical is that there was something called, and I'm not, deep learning or machine learning, where computers could take all the information available to them and then put it together in ways that weren't pre-programmed. And so it looked almost as though machines, computers, there were algorithms where computers could actually think. And I say that in quotation marks. So, and that's when we start seeing things like chat GPT, where you could ask the program to create a poem, to find something, to locate something. And we started getting things like um, talking about programs that could be used so that we would have self driving vehicles. And so the big change is that computers are now super fast and they're able to do things that look almost human. Think, see, process information. And the question is, can computers outsmart people? And I guess the answer is yes. And then what does that mean for us long term? Short term, people are worried that computers may replace their jobs, meaning that if someone has data entry, a computer could handle a larger volume of information over a shorter period of time. And so we wonder just how disruptive this will be. That's my total understanding of artificial intelligence. Please um, add to it, edit, clarify as needed.
Yeah, I think you said it right, in a way whereby the audience can easily understand it. I think it's a good way to kind of like summarize it. So yeah, I don't think I have
Oh,
anything else to add. I think
and
it's a
so, yeah,
good
okay,
summary. Mhm.
good. So there are lots of different aspects to artificial intelligence, meaning it's not just one thing. There's artificial intelligence that might be used to um, create a chatbot. There's artificial intelligence that might be used to help to visualize items. And then there's artificial intelligence, and I think this is what you're involved in, that's involved with natural language processing.
Yeah, yes.
Okay,
Mhm.
so now take it away. Tell us exactly what happens with natural language processing.
Okay. So I'm going to give an example, like talk about why I'm doing this work. So like I grew up in Nigeria, and for most of us growing up in maybe developing countries, when you go like see a doctor, most times, your notes are like written down and then they are stored in a file. So sometimes they are not stored in a computer because in certain cases there is no constant power. So there is no need to even store the information in a computer because maybe the next time you go to see the doctor, there is no power, so they cannot pull out your your clinical notes. So then if, for example, you've seen this doctor like 5 times and then for some reason you go see a different doctor, then all your history, your medical history, you have to re-explain it again to the new doctor. And most times you don't remember everything else the other doctor, wrote in your notes, either
Mm,
because some of the words are difficult for you to understand. So you relay the information that you remember, like your previous medication and your previous symptoms, you try to remember it and you pass it on to the next doctor. But most times the information might not be accurate, right? So thinking about this and coming over to Canada to study, I realized that, like, generally, not just in like in places where there is no power, but sometimes too in developed countries, these same health records, like where physicians write descriptions of, like, what's going on with a patient and so on, the same health records, about 80% of them are not being used by the health system to make any decision. So mostly health systems usually rely on like billing data. So they focus on their billing data, they focus on their hospital records. So yeah, so this, personal touch to healthcare was kind of like missing because like in the past there was no technology to be able to, utilize this data
mm-hmm,
to derive like value for like patients or for the health system. So there was no technology to do it. But like in the past 20 and in the past like 10 years, there's been a huge acceleration in terms of like technologies to be used to, access this data, to be used to extract information from it that can help like health systems, make better decisions for like patients, to improve patient outcomes, to improve patient care. So the technology has developed in such a way whereby being able to extract information from these records to help patients is now possible. So for me, I'm passionate about this because I know that in developing countries, it's going to help a lot to build systems whereby we can put or digitize those healthcare records and then be able to feed them into machine learning models to be able to make predictions, to be able to help in like healthcare decision making. So yeah, so that was why I started the company. I was like, I want to be able to you know harness this data that is not being tapped and be able to use it to help to improve patient care, improve healthcare decision making, and also improve people's lives at the end of the day. So that is why I am using natural language processing and advanced technologies to, help patients.
All right, that sounds very noble and admirable. Can you give me a specific, like what type of information would
Oh,
would you be able to extract? Who would actually have that information, and how does that actually help in decision making?
so for example, let's say, let's focus on like patient reported outcomes. Let's say, for example, um, let's say a black man or a black woman goes to see a doctor, and then they're telling the doctor, oh, I have stomach pain, and the pain is severe. They're trying to explain that to the doctor. But
Mm-hmm,
then the doctor isn't paying so much attention to what the black person is describing to them.
mm-hmm,
they are they are saying that they have added in their clinical note that, oh yes, the patient describes severe pain in the abdomen, but
mm-hmm,
then in their own minds they're like, maybe it's nothing serious. I recommended that the patient should go home and have some rest and maybe drink some water, that they have not been drinking enough water,
mm-hmm.
rather than them to recommend a specific type of test to this patient. So now that clinical note is just there. Really, no one sees it. So it's just there, except the doctor goes back again, or if their systems are interconnected, where if you go see another doctor, they'll be able to pull up your notes, then they might take a look at it. But then for this patient, the patient is like, oh, I've gone to see this doctor, I've explained. Maybe to them, they're like fine with what the doctor told them. But let's say in the next maybe 2 days or so, the patient, you know, is rushed into the emergency department now because the stomach pain has turned into something worse,
Mm-hmm.
right?
Mm-hmm.
So what natural language processing does is it can be able to go into those clinical notes. And let's say we're interested in looking at patient experiences, like let's say black women experiences when they are talking to their OBGYNs,
Mm-hmm.
describing their symptoms to them. They're trying to look at that. So we can go in and write an algorithm that specifically identifies those patient experiences from clinical note to say, okay, this patient was describing or was complaining about this type of pain, and they complained about it 2 days ago. And then now they're in the emergency department. So that might mean that the doctor that they saw didn't pay so much attention to like examine them to really find out what was wrong with them, right?
Yes.
So when we find things like that, we can bring it up and say, okay, so this is what is happening in your clinic. or this is what is happening in your health, in your local health area. So like, what can we do to make sure that like black women or black men or people of color or marginalized people are being like,
Hurt.
what can we do to make sure that they are not being hurt, to make sure that they are being heard, to make sure
Yes.
that they are being treated well, So that
Yes.
is an example. So that is how this type of work can help to improve their care later in future. So if maybe there are policies in place to ensure
Okay.
that
So,
we,
question for you.
yeah,
Um, the same scenario, the woman or the person is talking to the doctor saying, I have pain. The doctor is being dismissive, thinks not enough water intake. So the audible conversation is being recorded into the notes.
yeah, yeah.
So at the end of that visit, we not only have the doctor's impression and plan, but we also have a text of the patient's complaint.
Mm-hmm. Mm-hmm.
Okay, and so that becomes part of the medical record. So that if there's, like you said, 2 days later, worsening of the pain, you can actually document that she actually said she had this pain 2 days ago and nothing was done.
Mm-hmm. Mm-hmm. And AI helps us to do this at scale. So we can do it for thousands of patients, millions of patients. We can go back in time to look at notes from the past to
Okay,
check.
so I
Yeah,
didn't mean to cut you off. Go ahead.
sorry, it's fine. It's fine. It's okay. You can ask your question.
So, with the conversation between the patient and the doctor, does the patient also get a recording, a download of that conversation, or does it go directly into the medical records?
Um, I think it depends on the system, on what type of system is being used at the hospital or at the medical center. There are some where there are apps where at the end of the day, after seeing the doctor, you go in and you see a recording, you see the medical notes, you see what the doctor was saying, you see your complaint, you also see your prescription medication also, and you can use the prescription notes to go and get your medication from the pharmacy. So it depends on how the system is built and how it is set up.
And so, is it strictly um, audible, meaning that the this with this natural language processing, is it um, what gets transcribed or what gets put into the note is what actually was said, or does it also have the ability to um, search the internet and find out what medications I'm taking, or what health searches I've done in the past 3 weeks?
Okay, no, no, it's not connected that way. I think if we set it up in a way whereby it just records like the conversation,
Okay.
yeah, so it records the conversation and then it could summarize it, like summarize the conversation into something smaller. If you want to just read the summary for next time, you can easily read the summary for next time. It can help you, summarize things quickly. And then it's not just summarizing things. It can also, like for example, if you're looking at cancer, for example, it can like extract, like cancer phenotypes. It can, okay, let me not say cancer phenotypes. It can extract information like tumor morphology. It can extract like laboratory results like gene, amplification status. It can extract information like tumor behavior. So there are kind of like a range of things that we can summarize and extract. But in terms of going to the internet, like you were asking, we don't do that yet, where it goes into the internet to look you up.
All right. So now it's actually sounds like it's more than just the audible conversation. It sounds like
Yeah,
it can retrieve data, pathology
yeah,
reports and
yeah.
radiology reports, so that there's a comprehensive um, view of the patient, you know.
Yes, yes. Mm,
Okay.
mm,
And and so the premise is that the more we know, the better we can provide care. We have a better understanding of what's going on with this patient.
yeah.
And the other benefit that I hear you describing is that it can help to what's validate or identify times when people feel disregarded. And so that can be a teaching lesson or a way to identify things like systemic racism.
Mm-hmm. Yeah, yeah. It can do those things, yes. And then I can add a few other things that it can do, but I think right now my company isn't focused on that yet. I think maybe in the future we will be able to do those.
Mm-hmm.
So it can also help in clinical decision support, like maybe for like clinicians after the AI has looked at the notes and the patient record, it can make like recommendations for, what type of care the patient can have, or maybe what type of medication to, prescribe to the patient. But there are challenges to these things because it depends on what type of data you use to train the AI model.
Yes.
For example, like I think in 2019 or so, IBM Watson for oncology, developed kind of like a software that you can use to help out with clinical decision support. But some of the, challenges and concerns that came with it was that in terms of like accuracy of like what it was recommending, the accuracy was really low, and the reason was because the data they used to train it, they
Mm-hmm.
used hypothetical cases
Mm-hmm.
from like, a cancer site that was highly specialized. And then when they try to use this same software in the real world setting, it was giving unsafe or incorrect recommendations. So, in terms of like using AI for this type of work, I feel like we are still in the infancy. We are still learning more. We are still improving the systems to be
Mm-hmm.
able to do this work better in the future. So that is something else that natural language processing AI can also do in the healthcare setting.
Yes. Yes. Okay, so I'm curious, how does one start a company? How did that come about for you?
Um, I think first of all, to start a company, you need to identify like a need, something that you are passionate about, so something that is affecting the lives of people, and you have a solution for it. So it could be maybe like a product, for example, the people in maybe your community, you think that they need clean bottled water, but then or you think that they need clean water, for example, and you feel like the water sources around your community isn't that great for them, then you could start a company to get clean water to them. So that is one way you can start a company. So for me, I started it based on the need I saw. I was like, okay, so even in developing countries where I'm originally from,
Mm-hmm.
I see this as a need, and I think we can like creating something like this can help also to help build like systems that can ensure that we have connected and online medical records, so we can better provide care to like patients. So I was like, okay, I'm passionate about this thing. I'm passionate about providing like high quality care to like patients. So it's good that I, start something to address this concern. So that was how I, went into this.
Yes, and based on my readings, the one thing that everyone seems to agree on is artificial intelligence is not going away. It's not a fad. It's going to be integrated more and more into our daily lives. And
Yeah.
you mentioned um, it's good to have persons of color, diverse people putting input to ensure that the data that's given to these artificial intelligence algorithms and systems um, accurately reflects us. And so
Mm-hmm.
that's commendable. So how long have you had this company?
It's close to a year now. So in October it's gonna be 1 year.
Okay.
So yeah, it's close to a year.
And uh, self-funded, how have you gotten funds?
It's mostly self-funded, I think, because I have a full-time job also.
Mm-hmm.
So I work with a bunch of like engineers who help me out with some of my projects. But yeah, I'm definitely going to be looking for funding. So anyone that is interested in, working with us can reach out to us too.
So sure. So again, tell your name, give your contact information if people want more information about what exactly you're doing. Maybe they have contacts. Um, yeah, please share your information.
Yeah, yeah. So my name is Tamunoibim Sambo, but you guys can call me Ibim, Ibim, Ibim. I go by Ibim. And my email is IBIFRANK number 4 at gmail.com. So you can reach out to me if you want to know more about what I do, if you want to work with us on a small project, or whatever you want to, or if you have any questions, you can reach out and ask.
What type of help are you looking for? And if you would just say your email one more time.
Or email IBIFRANK number 4 at gmail.com. So yeah, what type of help? Definitely, I am looking for funding. I am like the next few months, I'm gonna really use it to apply for like funds and stuff, so I can grow the company. So help, support, and yeah, and also new markets. Anyone with ideas on new markets, places to enter, can
Oh,
also contact me.
and so you're an engineer by training, correct?
I am a health scientist. So I am a health scientist with like natural language processing and machine learning training.
Oh, self-taught.
Yeah, self-taught and took a bunch of like seminars and classes, but because I'm passionate about it, I spent a lot of time in the past 5 years to actually learn it.
So are you doing the coding or creating the algorithms for this natural language processing?
I create some of it,
Okay.
and my engineers help me also. So I work together with the engineers. I create some, and then they also help me out with some other things that I'm unable to do.
Okay. So take home message. What is it that you want us to understand about um, natural language processing, AI, your work?
Um, I think, like you said, natural language processing, AI is here to stay, and as computing power, grows, so does the model. So the models become increasingly powerful. So they are here to stay, and in the near future, they are going to be, prevalent in our daily lives, in most of the things that we do. So my take-home message is just I want people to think about this, like people working in AI or people trying to get into AI should think about, a way whereby all these systems, like thinking about human autonomy, like human well-being, safety, like transparency of AI models, whether or not they can be explained. Also thinking about like responsibility, accountability, and also models that are inclusive, and think that also includes equity, because we don't want models that discriminate against certain groups of people, or based on people's income, or based on their race, and the model keeps on disenfranchising a certain group of people. We don't want that. We want, models that we want people that work in this field to think about responsiveness, sustainability. So it's just things to think about to make sure that when we are, you know, participating in like groups where they're talking about AI, let us build this specific AI, or let's work in healthcare. So thinking about all these things to ensure that our models give value to humans, not just make money for the corporations, but
Hmm.
it's making human life better, and it isn't causing harms to some of us in any way, that we are all happy with, the type of models that we are creating and the value that AI in general is bringing to the human race. So yeah, so those are my thoughts about it.
Well, I have to say thank you. Thank you for um, assuming the task. Thank you for caring. Thank you for trying to do something about it. Um, I forgot who said it, but apparently there's a saying that the best way to predict the future is to create it yourself. And
Yeah, yeah.
that seems like that's exactly what you're doing. So, um, thank you for taking the time. Um, Stay in touch. I like to know how things go for you.
Okay. Thank you very much for having me. I'm happy and excited, to have chatted with you for this past 2 weeks. So thank you so much.
You're welcome. Take care.